name is Dr. Shelake. I have completed my MD and I am with Dr. Khedekar for last 15 years. Today's topic is about the app. In today's world, so modern technologies, we have to be with the world or else we will not evolve. This is the shortest and fastest method to go through a repertoire. Khedekar expert system. This word itself says it is an expert system. When this expert comes into play, if you have expert opinion in that particular field, only then you can bring in the revolution by your thorough knowledge, experience, education and the deep understanding of the philosophy of that particular subject. And not everyone has these qualities. Now we will see a small demo of this revolutionary app. This app is available on Google, Blackberries, iPhones. First you have to sign in, then you have to put password, your name, age, sex, occupation, then you have to select the systems, then the complaints, and in these complaints all sorry conditions are given. There are 12 rubrics which are taken into consideration on the basis of holistic and logical principles of Dr. Samuel Hahnemann. You come to a group of remedies. While selecting these 12 rubrics, explanation has been given so that the user who is using or selecting this rubric doesn't have any problem. After selection of 12 rubrics, we come to a group of remedies. Dr. Khedekar has given his clinical hints in the points ruling in and ruling out and the entry point for each and every remedy. That will differentiate every remedy from each other. So this is how it will help a user to prescribe a single remedy at a time. So in this, all sorry conditions are given. After submitting this, you will come to the first rubric, that is will. As Dr. Hahnemann has said, you have to treat a patient as a whole, not the disease. You have to understand a person, how he comes, how he talks, how he behaves. Will can be both positive as well as negative. So in this, there are 3 parts given. Will can be positive, very positive, extremely positive. It can be negative, very negative, extremely negative. Depending upon that intensity, we have to select the rubrics. What are the criteria to select this will? So this information is given below the rubric. Thermals. What climate can a patient tolerate? Is he hot? Is he chilly? Is very hot? Extremely hot? Very chilly? Extremely chilly? If I have these 6 remedies, what medicine or what remedy I have to prescribe for a patient? How I am going to differentiate in between these remedies? If we select the information by clicking on the remedy, there will be a Madra Medica which will show the entry points of that remedies that has to be in their patient ruling in and ruling out feature. Groups are also discussed like animal kingdom, halogens, metals, nosodes, sarcodes, minerals, vegetables and acids. Once you decided that X remedy is to be given, you have to click on the prescribe, then the name of the remedy will come, then the selection of potency which is important. So there are 4 types of potencies which are recommended, like 30. Potency is recommended for slow, obstinate and chronic course of pathology, for conditions lasting for few months or years. 200 for dynamic and fast course of disease or changeable modalities in conditions lasting for less than a week. 1M for intense or increased sensitivity, and 5M the symptoms only on the mind, acute or chronic, and the duration of how many weeks you want to tell your patient to come back. So your prescription has been saved in this application. Once a patient comes, you have to click on follow up, you have to click on view case, so you will know what rubrics have you selected 15 days back, and then you can take a follow-up. Anyone can prescribe a remedy, that is not a big thing. But to judge in the follow-up, that is most important. How you are going to look into that follow-up, that whether the patient is improving, not improving, or the condition is same, till what time to wait, when to repeat the dose. This information is also given in this application, that what are the principles, what are the difference between allopathy and homeopathy, and the most enlightening concepts are ruling in and ruling out. What is the aim? Why Dr. Khedekar has evolved to this level? As we know, the Dr. Hahnemann is the founder of homeopathy. He has said in the book of Organon of Medicine in the aphorism 9 that in a healthy condition of a man, the spiritual vital force, dynamics that animates the material body, rules with unbounded sway and retains all the parts of organism, it admirable, harmonious, vital operation as regards to both sensation and functions, so that our undwelling reason gifted mind can freely employ this living healthy instrument for the higher purpose of our existence. The aim behind this is to make a patient to live for the higher purpose of his existence. This is the biggest thing a doctor, a homeopath can achieve in his life. Khedekar Expert System, the best homeopathic app which has made my life better.